Hello, my name is Bonnie Anderson. I was diagnosed with breast cancer 25 years ago. When I was diagnosed, my journey through breast cancer was not hard at all. I had just married my wonderful brown eyed soul brother. I was happy. I had all of the support I needed. I had great insurance. I had everything I needed to fight this disease. After I began to heal, I wanted to help other women affected by breast cancer. I wanted to learn as much as I possibly could about this disease. What I learned was very troubling. I learned that African American women die at a greater rate than any other population nationally or locally. I learned that African American women, 42% of them, more of them, die from breast cancer than any other population. I decided I had a moral obligation to effect a change in as many of these women's lives as I could. I, with several other nurses here at Milwaukee Catholic Home, started an organization called Nurses Affecting Change. For the last 15 years, Nurses Affecting Change has presented breast health programs to low-income African American women. These programs are held 7 to 8 times a month. We go to apartment complexes, we go to homeless shelters, community centers, schools, churches. We go wherever African American women congregate. Our clinical nurses help these women facilitate their need to go for clinical breast exams. We have women who we send for mammograms if they're age appropriate. If these women are diagnosed, we then follow these women through their diagnosis. The funds that we need for these programs, we pay the nurses a very small stipend for gas so they can go back and forth to programs. These nurses perform clinical breast exams at each program. We have been able to reach 2,000 women every month since the inception of Nurses Affecting Change. We also serve lunch at all of our programs. Many of our women are very low income, especially the homeless. So we make a point of having a nice hot lunch for these ladies at each one of our programs. We will continue to understand the needs of African American women. We will continue to fight to help these women for as long as there is a need. Thank you for your time and attention.